and welcome to the Bronx Journal. I'm your guest host, Deidra D. Veals. In these difficult economic times, where do you go? Who can you call on for medical coverage? And the new health care legislation, do you understand it? Here to answer some of those questions for those in need of health insurance is Vice President of External Affairs at Healthfirst, Mr. George Hulse. Welcome to the show, Mr. George.
Hey, welcome. What a pleasure to be here.
Thank you, thank you. So tell us a little bit about Healthfirst. What is Healthfirst?
Healthfirst is a not-for-profit managed care company that provides high-quality health care to individuals and families in New York and New Jersey. Our mission is to improve the health and well-being of underserved communities in those communities we service. We have actually almost 600,000 members. We have 595,000 members in New York and New Jersey. In New York City here, we insure 1 out of every 16 people who live in New York City.
Wow.
So we insure an awful lot of children, we insure a lot of adults, and we insure about 100,000 seniors. So in public health insurance, we insure more people than anyone else in the city of New York City.
Okay.
We're owned by hospitals. We're owned by all the public hospitals, the HHC hospitals, as well as most of the private hospitals here in New York City. Okay. And we're actually the largest HMO in the country that is owned by hospitals. Right. So we're a not-for-profit HMO. We are your community partner. We work for you. We are part of your community. And we are committed to improving the quality and life of the people who we service in this great town.
So when you say community, who are actually, what encompasses the community?
For us, the community is anyone who needs public health insurance. And public health insurance has a new name now. You know, we often call public health insurance Child Health Plus or the SNP. So anyone that has a child, up to including 18 years of age, who lives in New York City, and if that child does not have insurance, that child qualifies for Child Health Plus. And that's one of the services that we apply. And then we have insurance for a lot of people who work part-time or people who do young adults who do not have a high income. And that's called Family Health Plus. And we have a lot of students right here at Lehman College who we insure, who come to school here, and we give them insurance. And we have a lot of people who have Medicaid insurance that we insure. And then we have about 100,000 seniors who have a Medicare Advantage plan, and we give them insurance also. Okay. So we insure an awful lot of people in this town, and they come from a cross-section of people. You know, New York City is the greatest city in the world in terms of having a great influx of a lot of people. And so, you know, a lot of them are African American, a lot of them are Latinos, a lot of them are Chinese, a lot of them are immigrants, a lot of them are Russians. A lot of them are Indians. They come from the entire segment. Right, right. But they're all people who qualify for public health insurance in some capacity, and we insure them at our owner hospitals. We have about 25,000 doctors in this New York City metropolitan area. So we're very proud of the service that we give to people.
And so who are some of your competitors? Because there has to be a lot of health insurance companies out there.
You know, there are a lot of health insurance companies that are not-for-profits like ours. There are quite a few of them. I never think of them as competitors. Okay. We all work hard to provide service to the people who we work with. And so I never think of them as our competitors. I really say that our competitors are really fear. Mm-hmm. Because a lot of times a person might be an undocumented immigrant who does not realize that his or her children qualify for public health insurance. Right, right. So our competition is fear. You know, our competition is a lack of education. People don't understand the services that we provide. In this town, there are probably 500,000 people who qualify for public health insurance who don't have it because they don't know that they qualify for it.
So how do I qualify? Because I don't have health insurance.
Okay, let's say you're a student here at this great institution and you don't qualify for public health insurance. Then you should go to our website, healthfirstny.com, healthfirstny.com, and you will see there how to apply for health insurance. And we will ask you some questions, and we will ask you to contact us. And then we will take your contact information and we will call you up. Okay. And then we will call you up and we'll arrange an interview to meet you at the college or at your home, and we will talk to you and find out if you qualify for public health insurance. And if you qualify for public health insurance, then we will enroll you into our insurance plan. And then you will have the insurance that you deserve, and you'll have that insurance in this case for a year. And then every year we recertify to see if you qualify again.
Every year? Okay.
Yes.
Okay.
So, you know, I say to everyone who goes to this great institution, you know, and all of the city colleges, you know, we work on site at a lot of the colleges. We work on site at City College and a lot of other schools, and we encourage those students to stop by our tables and see if they qualify for public health insurance.
How do you?
You also see us in the community. I'm
okay,
sorry,
go ahead, I'm
but you
sorry.
also see us in the community. We work inside of supermarkets. We work inside of pharmacies. We work in laundromats. We work at all of our hospitals. We work inside of providers' offices. We work inside of federally qualified community health centers. So all of these locations, we try to work where our constituents live. And we try to be culturally sensitive. So in those areas that might have a high Dominican population, we try to find a Dominican person who can work there. Because that person will understand the culture of the Dominican population. Right. And where there are high concentrations of African Americans, we try to find African Americans who will work there because culturally they will understand it.
Right.
Where there are South Asians, where there are Chinese, you know, we try to find Chinese reps who will work there. Where there are Hasidics, we try to find Hasidic reps who will work there. So we try to find people who are culturally sensitive.
And is that how you get the word of mouth out? Like, how do people actually hear about Healthfirst? Is it through advertisements, through those representatives?
We are the largest in this city because I think we're the most active. We are very, very active in the community. We sponsor about 200 events every month. Wow. And so, you know, many of these events are not really clinical. So it's not really, many people would not understand it as being a part of healthcare. Like we have something that we do with parent coordinators, where we have an event where we work with a lot of the state senators, and we honor parent coordinators. Parent coordinators work at the schools, and we have a parent coordinator awards breakfast. Well, that's education. So a person might say, well, that doesn't seem to me like it's healthcare. Right. Well, it might not be clinical, but to salute these people, to us, is a part of what we do. Because we want to improve the quality of life of our constituents. And sometimes it might be sponsoring something about domestic violence. Right. Sometimes it might be sponsoring something about immigration. And very often it's about sponsoring things about nutrition, about wellness. We also sometimes sponsor karaoke events because we know if our constituents are feeling good about themselves, they're going to have better health. One of our big pushes is always in education. Mm-hmm. And at Healthfirst, we are the health plan for 365 schools. And so at 365 schools, we're the only health plan that works at those schools. Because we think there's a direct bridge between education and healthcare. We know that if a population is healthy, they're going to have probably higher income. There's going to be less domestic violence because very often domestic violence has an economic end, you know, lack of economics. Right, right. You know, we know if we can keep our clients educated, they're going to be more apt to have a better diet, they're more apt to exercise, more apt to encourage their children to have a better diet, more apt to go to the doctor more often. The biggest challenge.
So these outreaches, that's what helps them.
Yeah, so that's what we do. You know, we work in the community and we put together events. You know, we're going to be busy here in the Bronx for Bronx Week. We'll be working with the borough president on Bronx Week. We sponsored with the borough president, and he's a great guy. Okay. I'm the president of the borough president's fan club. We partnered with the borough president for Dominican Heritage Month. And so we sponsored several events with the Bronx borough president for Dominican Heritage. We sponsored several events for Black History Month, for Martin Luther King's holiday. So these are the sort of things that we'll do. And we'll be out there. People in the Bronx will see us out there also for Bronx Week.
And do you have offices? So with all the community events and getting members that way, do you also have offices that the members can go into?
Yes, we do.
Members?
And here in the Bronx, we have a community office right on Webster Avenue, right off of Fordham Road, in the old Sears building, right on the side there on the Webster Avenue. And I encourage anyone who's in the Bronx who does not have health insurance to stop by our office and see if you qualify. If you have children and they're not insured, I assure you, your children qualify for public health. If they're up to and including 18 years of age and they are not insured in New York City or New York State, they qualify for public health insurance. So if they're students like you and they are uninsured, I'd like you to stop by our office or give us a call and see if you qualify. If you have parents or grandparents who are seniors and they have Medicare but they don't have a health plan, we'd like for you to give us a call. They may have them give us a call. They may qualify for one of our Medicare programs.
Okay.
So we are your community health plan.
I have a question for
Yes.
you in reference to what's happening with Obama and the president. How does the healthcare reform affect us at this moment?
Let me say this. The president is most certainly an American hero. We have been trying for many, many years to get healthcare reform passed. Many presidents, including President Nixon, tried to get it passed. President Clinton tried to get it passed for a long time. So we most certainly applaud the president for getting this done. And this ensures that more people are going to have insurance. And that's exactly what we want to do. Absolutely. So we most certainly think the president is a hero. It's a very difficult step, but you've got to remember that we are the only industrialized country, major industrialized country in the world that does not have health insurance for everyone. So now we are catching up with all of Western Europe, and we're catching up with New Zealand, and we're catching up with Japan, and we're catching up with the rest of the industrialized world, and we're giving everyone health insurance. So we applaud the president and the things that he's doing. It's quite ambitious, and it's going to be quite a task, but it's very, very necessary for everyone to have health insurance.
Yes, absolutely. I'd like to thank you, George, for coming on to the show this evening, coming to these viewers' homes. Can you give us some contact information for Healthfirst? Yeah,
listen, if you have a child or anyone who needs health insurance, I want you to call me directly. My name is George Hulse. I want you to call me at 212-801-6062. That's my direct line, 212-801-6062. And I will make sure that we will make arrangements for someone to come to your home or to meet you at your place of work and talk to you about public health insurance. If you have a child in this city, I don't care what the child's immigration status is, up to and including 18 years of age, that child qualifies for public health insurance. If you are a student at a great school like this and you do not have health insurance, please reach out to us. And we'd be absolutely delighted to see if you qualify for public health insurance.
Thank you, George. Thank you very much.
Thank you so much.